My name's Juliana, and this is the story of my son Harry and his journey through the health system. His running diagnosis at the moment is inflammatory bowel disease with liver disease. He became ill when he was 3, just before my second son was born. We tried a range of different treatment and eventually they found a combination of drugs that seemed to manage his symptoms. So he was on roughly 40 tablets a day. In the early days, I used to plot his results on a spreadsheet, and that allowed the doctors to keep a track of what they were doing and how it was impacting him. By the time he reached year 10, the doctors decided that it would be best if they removed his large bowel. And one of the things that I used to worry about was when he was in hospital, he has an allergy and he used to wear that funny little red hat, but it was the only way they knew that he had an allergy. After a period of recovery from the first operation, in year 12, he went back into hospital and had another big operation where they removed a whole lot of adhesions from his bowel.
Every time I actually had to go for an appointment, they had to send a request ahead of time to have my records brought to my specialists on a little trolley because there were so many of them. But now it just makes so much more sense that something like that should be digitised.
When Harry moved to adult care, his 17 years worth of medical records was condensed into a 3-page referral letter.
I knew it would mean that my new specialist didn't come at it from a perspective of actually understanding where I came from as a patient, which was difficult to deal with at first and quite frustrating. Undoubtedly, one of the biggest benefits for me as a patient is that I can now access my medical record on an app on my phone, which, if you're someone my age, goes everywhere with you, irrespective of where you actually end up going. And that, as a patient, I think is incredibly powerful because it means that my specialists and nursing staff and my psychologist know everything they need to know about me without me having to actually communicate it to them, which saves them time, it saves me time, and it just means that the care I receive is a higher quality and it's more efficient in how quickly it's delivered.